I'm just
Hey, Tribe, we're live. So thankful to be here with the CRNA Group, Dan, Hilary, and Ryan of Nurse Anesthesia 101. Hey, guys.
Hello.
Hey,
hello. How's it going?
Good. So I am stoked that we have finally pegged down some CRNAs who actually want to talk to us. This is almost 2 years and trying to find somebody that will chat with us. And now we have 3 of you who bring such different backgrounds and strengths to the world of nursing as well as nurse anesthesia. So I can't tell you how stoked I am to have you guys as guests. So Dan, we'll start with you. You've been a CRNA since 2011 with prior history in corporate America. That's got to give you a totally different perspective and view and relatability in different ways. So I'm super excited to hear about you and your transition to the world of nursing.
Sure thing.
And Hilary, since 2015, you've been a CRNA. I love that you've shared your passion for developing that work-life balance. And we got lots of questions about that. So I know they're going to be excited to hear from you. So hello and welcome. And then lastly, but not least, Ryan, you've been a CRNA since 2015, and it sounds like you are so passionate about educating the world of CRNA and nursing, as all of you are, but that you guys have all started this movement of Nurse Anesthesia 101 to help others desire to join that profession, find their way, educating them, supporting them, and coming alongside them. So I am super excited. Welcome, guys.
Thank you.
Thanks for having us.
So that was a lot of blah, 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 but let's get to the stuff that people really, really want to hear about. Let's talk about your path into nursing just really briefly, because everyone is super excited about where you started and what led you here.
Sure thing. I actually went to school and obtained a degree in public relations and was working in public relations and advertising and hitting a lot of roadblocks, and figured out that while I love doing those type of jobs and working in that career field, everybody else in my family was in healthcare and used to talk about how much they enjoyed helping other people and interacting with the patients. And I did not have that connection in the business world with our clients. And so the business world was getting very tricky at that time to maintain employment. And so I started kind of going back into the family business of looking at healthcare degrees. And both of my parents grew up in nursing with their careers. My dad is also a CRNA. And so I just started examining kind of the age-old question of what did dad do? And one thing led to another. And I landed in nursing school and then pursued the degree in nurse anesthesia.
That's awesome. Do any of you want to share your path into nursing, Ryan or Hilary?
Sure. So for me, both my mother and her mother were both nurses, still are nurses. And when I went back to school, I initially started out as an accounting major and absolutely hated it. So my mom actually suggested, why don't you take an anatomy class and see how it goes? And I absolutely loved anatomy and decided to kind of take the pathway into nursing from there. And then while I was in school, I learned about anesthesia and decided that that was kind of the path that I wanted to take after I graduated from nursing school. So every step that I took after graduating from nursing school led me to anesthesia. So.
Awesome.
Yeah. I had a little bit of a different journey to nursing, but I'll try to keep it short. I finished high school and went to Virginia Tech studying civil engineering for a year. After that year, I found that I was bored. I wasn't passionate about it. Ended up moving to Florida, had family down in Florida, and worked for an IT company for about 2 years. It was my father's business. Did really well with that, designed some marketing material for them. And shortly after that, he sold the company. It was a publicly traded company. He was bought out, did very well with that. But I had to find something else to do. I met some musicians and I decided that I was going to be a rock star. So I did that for about 6 years, and that was fun. It doesn't tie into nursing at all,
No.
but I got to a point where I wanted to start looking at starting a family, and I figured nursing would be a good stable profession to get into. My mother had been a nurse her whole life, and my mother's mother as well, and they told me about CRNA, and I saw it as an opportunity to apply a lot of my technical background and math strengths into a medical profession that was very stable. And so I jumped right into my prerequisite classes and just soared through the nursing program. So excited to get to where I am now. And I just went right through and didn't stop. So I'm here now and happy to be here.
I love that all of your paths are quite different and have to really accent your different growths and strengths that you guys bring to Nurse Anesthesia 101. So we had a lot of questions come in, guys, and so we're going to do our best to cover all of them. And they're in some storms there in Florida where they live. So if we cut out and something happens, don't fret. We will reschedule and really hear from them at a future date. So let's get to it. Ashley, David, and Martitza, which I'm hoping I'm saying her name right. Who knows? They are nursing students and new nurses, and they're wondering what type of nursing experience would be most beneficial in preparing for a future in CRNA school.
So first of all, congratulations, to you guys who are pursuing the degree. It's going to open up a ton of doors, and if it hasn't already for you. As far as the type of nursing experience, obviously, pretty much exclusively around the country, the nurse anesthesia programs require ICU experience. There are isolated situations where they would consider level 1 ED experience. Sometimes it's kind of a situational basis. And so, but for the sake of this conversation, we would go ahead and say and recommend to everybody that if you are interested in considering obtaining, a license and being certified as a certified registered nurse anesthetist, then you need to make working in, I would say that the highest acuity ICU that you can possibly get into, make that your goal. And certainly while you're in nursing school, my own personal situation, I was working as a nurse tech in an emergency department simply because they weren't using nurse techs in the ICU at the time. But that helped get my foot in the door to hospital, and then I was able to, meet everyone that worked in the ICU and was actually doing nursing school clinicals in the ICU, which made it very easy to transition into employment in the same ICU. And so sometimes it's, stepping stones to get to where you want to be, but certainly that ICU experience is gonna be what bolsters your application.
Agreed.
Okay. Great. So another question that kind of leads into that is if it's 2 years required, or can they start somewhere else like the ED until an ICU position opens and go into the ICU? What's your take on that?
Typically, again, it can be situational. In my experience of evaluating people that we work with, evaluating their experience, it's those type of situations those people tend to get into nursing anesthesia programs if they have a lot of nursing experience. But,
okay.
Everybody's situation is a little different. Every school is a little different. The climate of the industry changes sometimes what nursing schools or the nursing anesthesia programs are looking at and considering. But typically, the schools that we have worked with and have attended is, when they say they want a year or 2 years or whatever the minimum is that they're saying of ICU experience, they tend to stick to that. It's very competitive to get into. And so from their perspective, there's not a lot of leeway, going into the interview process or, there's a lot, it's a very popular topic right now in nursing. And so we're expecting there to be increased applications.
Okay.
Right.
All right, good. So Keith asked if there any benefit to shadowing a CRNA prior to applying, and if so, how do they go about setting that up?
Absolutely. I'll answer that. We look at shadowing as basically a front row seat to what we do every day. If this is something that you're considering, you need to look at this as a long-term commitment financially. It's going to involve your family. It's going to take a big investment in time as well. So knowing that you want to do that, obviously you'd want to know that before you make this investment. So shadowing as much as possible. And once you've determined that you want to do it, we encourage that from that point on. The most exposure that you can get to the operating room and to what we're doing behind the drapes, anesthesia related, procedures, the better you'll be prepared for school. So yes, shadowing, highly encouraged, early and often, as many times as you can, even during the process of applying to school. Most programs require one shadow experience. I find that the more times you get in the operating room, the more you understand what we're doing,
Mhm.
and recommend you get in there as much as possible. It's not easy unless you know a CRNA, unless you have a friend that knows someone. Um, you just don't have a directory of CRNAs to look up and pick to shadow,
Mhm.
um, but you can find them. Um, we are working on a Facebook platform right now that we're going to try to find some opportunities in different areas of the country so we can help people get these opportunities. But shadowing, yes, absolutely beneficial, and you want to know what you're doing and what you're getting into before you make that commitment.
Absolutely. That's great input. And I look forward to your Facebook group being robust and have so many different CRNAs all over the country so that these people who are interested in shadowing and getting into this field will have some one-on-one contact. That'll be amazing. So Brandy wanted to know how long each of you were nurses before applying to CRNA school.
So I'll take that one first.
Okay.
I graduated from nursing school in 2008, December of 2008, and started working as a nurse once I passed boards in January of 2009.
Okay.
And I worked for 4 years before going to anesthesia school. So, and that was just one of those situations where sometimes, and this is something that new nurses may come across, is sometimes the ICUs won't directly hire new grads into the ICU. So I was met with that situation when I graduated. So I started in a progressive care surgical unit and then moved into the ICU after 2 years there. So that's why it took me 4 years instead of, I was hoping to do it in 2 years, but 4 years was what it was. So.
Okay.
I'll add to that. Same situation. The hospital I was working at did not encourage coming straight into the ICU.
Okay.
I worked at a step down neuro unit. It's a progressive care unit as well. Glad that I did that in hindsight. It helps me get organized and sort of learn the feel of nursing and bedside care. And after establishing that, I was able to transition into the ICU a lot easier and focus on the ICU level of care specifically. And there wasn't that student to ICU nurse adjustment, that shock that some have right out of school, that learning curve. So being an established progressive care nurse sets you up for sort of getting organized and learning nursing in an acute care setting in general before you take on all the big stuff in the ICU. So 3 years before I applied to school.
Okay.
I was the odd man out. I did exactly what just generally not recommended,
Okay.
which was I was doing my last semester of clinicals in the ICU that I ended up transferring into with an. I even had the same preceptor during my last semester of clinicals, and then the same excellent nurse became who I was shadowing and orienting with when I started working in the ICU. And everything that Hilary and Ryan is saying is 100% accurate. At the time, I was chomping at the bit. It was a second degree for me, and so I felt like I was constantly just making up for lost time in a lot of ways. And speaking back to my father, it was just I was like, all right, I'm doing the same thing my dad did. He was active duty as a nurse, went to anesthesia school in the Air Force, and he used to talk about how it kind of drug on and on and on before he got a slot to go to anesthesia school. And so it was kind of a notch in the belt for me when I didn't have to do that. I just kind of jumped out of school and went right into the ICU, and it all worked out. I was in a great environment. Luckily, I think that can't be understated. Is every ICU is different, and so I was in a very supportive ICU, and also having the same nurse that I was working alongside, from nursing school and then into the critical care training that we were doing. So all in all, I was working in the ICU for 24 months, almost to the day, when I went to anesthesia school. So
that's amazing. Super cool stories. All right. So in terms of your school experience, Martisa wants to know, what was your path to nursing anesthesia?
So the path, we talked about this briefly earlier. When I was working in the advertising world, there were 12 prerequisites that we needed to apply to nursing school. I had credit from my previous bachelor's degree for a whopping 2 of them. So I essentially started at 0. And so I think that the credits that I received were for English and sociology. So I was, I had 10 essentially science-based classes to work through to even apply to nursing school. And as Ryan mentioned earlier, I was locked on, full speed ahead. It was straight A's the entire way through those, and then applied to the nursing program at a local community college. It's kind of a unique program where you dual enroll in a local community college and at the University of Central Florida, and they sort of overlap the clinical requirement. So in a shorter amount of time, you end up with a BSN. You literally get your associates, and then 2 semesters later get your BSN. And then from there, I was stacking as many things as I could in my favor. So I was doing that, and while I was still working on the BSN, I started working in the ICU. Kind of had my sights set on that minimum time frame and applied to nursing anesthesia training.
Yeah.
And so it was. I had a lot of people telling me that there was no way that the plan was going to work how I had it laid out. By God's good grace, it worked out exactly as I laid it out. But it's not even something I would recommend doing that way. A little more planning is probably a better perspective.
So in terms of more planning, it sounds like you were super planned. What do you mean more planning?
More planning in the sense that I was looking at it from a time perspective. Again, it was I've been to college before. I've worked professionally before. I had hired people and fired people before. And so when I came back into this, it was just how do I get, I knew what I wanted to do. I knew I wanted to do anesthesia. So everything that wasn't a day that I was doing anesthesia was one day that was taking too long. But I made sure to check the boxes and learn what I needed to learn along the way as well.
So I'm wondering if her question was more geared toward, like, what was finding a school like? What did you do to prepare yourself for nurse anesthesia school? You answered that in terms of working in the ICU as a tech and then as a nurse, and you were ready, just checking those boxes.
Sure.
But maybe we'll get into that, finding a school, and what did that path look like? How would you recommend someone start on that path?
Sure. Join our Facebook group. That's a great step 1. But so we live in Orlando. We live outside of Orlando, Florida. There's 2 anesthesia training programs here. So the hospital system that we all worked for as nurses has their own college and has a CRNA program. And so I literally just applied to that program because it was here in town. There wasn't anything specifically about that program that drew me into it. It had a pretty good reputation, and it was relatively new. But I knew that the hospital system that they were tied into offered a lot of opportunities for learning, and so that's something that it cannot be understated. Is it's not just the reputation of the school; it's the hospitals that you're going to gain experience in.
Yeah.
Because once you get out of your training program, the education, the didactic portion absolutely matters, but so do the clinical opportunities that you were able to work through as a student.
Right.
So I'm not sure if that answers the question anymore.
Yeah, I think so. I think that's great. So Martisa, Brandy, and Kelsey all asked, why did you choose the path of CRNA versus ARNP? And you guys can take a little bit of a moment to explain what those acronyms mean as well.
So
Sure.
I'll take that one.
Yeah.
Okay.
So for me, coming from a family of nurses, I had the opportunity to kind of see the work environment for a nurse practitioner and see the environment as a nurse anesthetist as well. And both of those environments had positives and negatives for me. I did consider at one point the emergency department nurse practitioner program. I was looking hard at that and trying to compare that with CRNA school. But I kept coming back to the concept of autonomy, and that was something that was really important to me while I was in school for nursing. So once I was out, I decided to spend more of my time looking at the CRNA programs and looking at what that meant for me in terms of how I wanted my career to go. So that was kind of the path that I took. I did give myself the opportunity, though, to shadow both a nurse practitioner and a CRNA. I wanted to make sure before I made the decision that this was the path that I wanted to go down. And I know that Ryan had touched on that before, but I think that some people struggle with the concept of, do I want to do NP school? Do I want to go CRNA? And I say, if you can find an NP, reach out to even your local family practitioners. They sometimes that you go to will allow you to shadow if they know you're a nurse and you're looking down those career paths. And so that was kind of what gave me the nudge towards the CRNA route, was the autonomy and the fact that I was given the opportunity to shadow both career paths, and it made it much easier for me to make that decision.
Yeah, great advice. And we've done Q&As with 4 other nurse practitioners, some acute, some non-acute. So if some of you are like, well, I want to hear from a nurse practitioner, look in the library. There's several there. So that's great advice, Hilary. I love that. I didn't mention to those of you who are watching that Hilary and Dan are married. So there's that. It's fun that they're both in that together. Can you imagine both of them working with that schedule? But we're going to hear how that works soon. So Brandon and Kevin want to know, how competitive are various programs?
Ryan, do you want to take that question?
Yes, they're very competitive. I think pretty much every program across in the country is competitive, as in hard to get into, or are there different levels of difficulty? Is that what we're asking?
You know, I would assume, is it difficult to get into, and what kind of GPA do you need to maintain? I actually saw some discussion about that in your group.
Yes.
So that's always a great place for people to reference. But just for topic of conversation, yeah, how competitive are they? What GPA do people need to maintain?
Without really getting into specific numbers, I think it's a combination of things.
Okay.
I'll start with just work ethic. That has to be there from the onset. This is why we started our Facebook group and this supportive platform for people that are interested in this, is so that we can reach nursing students early and emphasize GPA. I mean, at the end of the day, on paper, if they're trying to decide who they're going to interview for school and who they're interested in, they're going to start with the numbers and they're going to go from there. A 4.0 GPA obviously would be ideal, not required. I've seen students that shadow me in the operating room that are anesthesia students that got in with a 3.5 GPA. We're very strong in other areas. So there's lots of pieces. The GPA is a big part of it. Your graduate record exam, your GRE score, is another piece of that. Once you get through all of the academic components of it and you get your ICU experience, getting critical care certification in the ICU, getting really good exposure to high acuity patients, and equipment and hemodynamic monitoring, whatever you can get your hands on in the ICU is ideal. So your ICU experience will come up during your interview. That is the last step. If you get to your interview, you're right there. You're at the door, and the interview is a huge part of it. And that's where it comes down to your personality, and they really want to dig down and figure out who you are, and if you're strong enough to handle the pressures of anesthesia school, and do an assessment of your financial plans, your family support at home, determine if you're a strong candidate that can manage this for 2 to 3 years.
All right. No pressure or anything. That sounds good. All right. Dan, do you or Hilary have anything you want to add to that?
So, I mean, the only thing that I would say in that situation is they are competitive. And I think what we're trying to accomplish with trying to reach out to nursing students is trying to emphasize the importance of the GPA and how important it is, along with the GRE scores. But please don't let that discourage other people that have already gone through nursing school and maybe that wasn't their strongest, time in school. There are other ways to try and, bolster your resume and your application to make you as competitive getting into school as well. There are other directions that you can reach out to, whether it's us or speaking to schools that you're looking at directly to improve your application to allow you to be just as competitive to apply.
Okay, so a question that I got recently, just in the group, they were talking about increasing their GPA and what that would look like if it would look poorly if they had to retake A and P. Let's say they got a C the first time and pulled off a B or an A the next time. What do you recommend those students who, especially in the sciences, are getting lower grades? Do you recommend that they go ahead and retake those?
100%, I would say yes. I mean, I think one of the things that we have heard time and time again from administrators at anesthesia schools is that the program is hard and it's challenging. It requires, I mean, it's every bit of the analogy of drinking water from a fire hose, and so you adapt to the pace of it for sure, but the initial first semester is there's a lot of wide-eyed, shell-shocked looks, and so that being said, that's part of why we're doing this, is to try to get people to a place where they are more ready, better prepared, better understanding of what it's going to be like. There's a huge, we truly believe that there's a huge, vast number of people out there that would be excellent CRNAs, that whether it's their life situation, financial situation, a lot of misinformation that we come across within the nursing realm of what it takes. And so that was a huge part of the motivation to get people to understand, what Nurse Anesthesia 101 is about. The bolstering the GPA, in my opinion, is a great idea, especially with the science classes. The flip side to that is the GPA is the hardest thing to adapt later on. You can retake GRE pretty simply. You can get resume help simply. You can get interview help from us.
Right.
But, retaking even a single class to bolster your GPA is going to take, at a minimum, let's just call it a semester. And so the age-old adage, just do it right the first time. That's not always the simplest thing to accomplish. But if you can, then, that would be a great goal, is to hit the GPA aspect very hard in the beginning. And then if you have to adapt things later on, that's probably a little simpler.
I agree. So to all you students, if you're watching and you're saying, well, I'm struggling in X, Y, or Z, reach out for help now. Don't
100%.
wait until it's a C at the end of the day. Like, reach out for help as early as you can. And, now's your chance. Get help.
Correct.
All right. So Martisa wants to know, tell us where you went to school, what programs, why, and what other programs you might recommend.
Well, I went to, I think Dan and Hilary both touched on the programs they went to. The local Advent Health hospital system, the program affiliated with that. I did the opposite. I was actually working as a nurse in the same hospital, but I thought it would be best for me and my education if I stepped out of my comfort zone and went to their competitor in the same city, another big program, Barry University. And the whole reason for that was I thought that I would be too comfortable in a very familiar environment, seeing coworkers, surgeons that I knew, and I didn't want a lot of small talk or distractions. I wanted to go away to school without moving. So I left my place of employment where I could have practiced as a student nurse anesthetist and chose another hospital system where I knew nobody.
Okay.
And I did that solely, again, just I thought I would learn better. I'd have less moving parts around me. So happy that I did it. And I'm happy to be back where I'm working now, and that is with these folks.
Okay, awesome. And any specific programs you guys have heard that have great, great reputations, but any recommendations in terms of what schools that they should look at across the country?
Yeah, there's a list of anesthesia programs. You can Google them, the top nurse anesthesia programs. I believe now, you guys correct me if I'm wrong, but I believe VCU, Virginia Commonwealth University, is known as the number one CRNA program in the country, and they're a doctorate program now as well. But there's a lot of great programs. I mean, our local program here, the program that Dan and Hilary went to, is fantastic. The CRNAs that are coming out of that school are well prepared, very, very strong CRNAs. And it's just a little known private school. It's here in Orlando. So
Sure.
I don't know what they're using to measure one program against the next, but you can look that up and find that information. And again, following us on Facebook, we can get you a lot of that intel as well, depending upon where you live.
Okay, perfect. So another question, as a student, how did you balance your school and work and home life? And what were your days in class, clinics, study sessions? What did the typical day as a student look like?
So it feels like it was only yesterday that I was a student when that question gets asked. But for me, going back to what Ryan was talking about in terms of comfort zones, that was one of the reasons why I chose the school that I did. I was familiar with the environment. I had friends that had gone to the program but prior to me. So I knew the schedule that they had. And it was great because the schedule that they were given was very structured. It didn't really change a whole lot. And so that allowed me to work my family life around that as well. I still had time to do things with, close friends. I had times where it was just strictly for studying. Clinicals were very well structured, so you knew what you were doing well in advance. You could kind of plan your life. There were definitely times where you felt like you were drowning. That's going to happen in anesthesia school. But the beauty in all of that is that you've got anywhere from 15 to 24 classmates who are going through the same thing as well, and you can lean on them.
Sure.
And I also was able to lean on my husband. I was fortunate enough that he had already graduated, a few years ahead of me, and so I was able to, vent to him, go to him for answers, and on top of that, what Ryan mentioned is when you're looking at these schools, if you have the ability to reach out to them and talk to the students that are in those programs currently, those students can give, prospective students a really good idea of what their day-to-day life is, how clinicals have been going for them, and how they've been able to manage their family, their finances, and everything else around it.
Okay, good advice. Do you feel like CRNAs as a whole use platforms such as LinkedIn to communicate and network with each other?
I mean, we do have some forums for that. I don't feel like LinkedIn is really used as much in the CRNA world.
Okay.
I find that a lot of the information that CRNAs and prospective students or current students get is simply from Facebook forums, actually. Students and CRNAs will go out there and say, hey, I have a classmate, they're looking for a job here. Does anybody work in this area of town? Does anyone know anyone? Or I have a family member who lives here who's having surgery. Does anybody know any CRNAs at that hospital that can help us out?
Yeah.
And because it's a small group in the grand scheme of things, it's very close knit, and there's always somebody on the forum willing to help out.
Awesome. That's great. Okay, so I had another question come into mind. Hopefully it'll come back. Anyways, Courtney asks, I see that a lot of programs are shifting to doctoral. Is the additional work or experience for an DANP worth it when ARNP programs are still master's programs?
I think it's totally worth it. It comes down to what you want to do. So, looking into ARNP it was the term for nurse practitioners. Now APRN.
That's what I thought.
Yeah, it's okay. It's just it's just terms. No, it's not really
Right.
a big deal. It's basically the same thing. Advanced Registered Nurse Practitioner (ARNP), and now it's Advanced Practice Registered Nurse. So somebody made that decision. I'm sure it's made a big difference in the healthcare community. But it really does come down to what you want to do. So that's why Hilary mentioned shadowing an advanced practice nurse in the ED setting, shadowing a CRNA. At the end of the day, you want to know what you're going to be doing the rest of your life. I mean, if you're investing this time and money into your education, hopefully this is something you're going to do the rest of your life. So, regardless of whether you had an extra semester to get your doctorate, as opposed to a nurse practitioner or APRN, maybe one semester less, really it comes down to what it is you want to do.
Sure.
So in my opinion, I think it's totally worth it. If I had to do it again, I would do it 100% of the time. I'd stick with CRNA even if I had to work harder to get there because I love what I do.
Okay. And Brandy just submitted another one. Is there much of a difference in the time commitment when comparing a master's program versus DNP? Are there even any MSN CRNA programs left?
So there are currently a couple of schools that still have a master's program that have not transitioned over to the DNAP program. I believe there is still one in Tennessee. I'm just not sure which one it is. In terms of the time commitment, you are talking an additional 2 to 3 semesters with the DNAP program. But I will say that I was fortunate enough actually to work with a student that's in a DNAP program right now, because the school that Dan and I went to has switched to a DNAP, and they have actually enjoyed the pace of the program. Even though it is longer, the way that they have spaced out the classes along with the clinical transition has been pretty smooth for them. And even though they were absent from the operating rooms recently because of COVID, they recently returned to the operating rooms last week. They don't feel like there was a whole lot, like, you get the wheels going again, but they feel like there wasn't a whole lot missed. And it's simply because the way that they're structuring these programs, you can really take advantage of the clinical time that you have. You don't feel so overwhelmed in that first semester and second semester because they have spaced out some of that didactic work that makes it a little bit easier going through the program.
Okay, good. Kendall and Sean both asked, do you feel like the debt obtained while in CRNA school is worth it for the pay you're getting now? Not working for 2 to 3 years seems daunting to put that kind of financial stress on my spouse while I'm in school.
So this is one of the key questions that we get asked about regularly, which is a good thing, because I think what it proves is that people who are considering going to graduate school are trying to be financially sound. They're considering the family, they're considering their kids. One of the aspects of this that causes anxiety for people, it caused anxiety for us, is the not working for 2 to 3. It's like you finally get out of nursing school, you're earning a regular paycheck, and now I'm going to put that paycheck away and not have that. But
right.
The thing to keep in mind is that instead of looking at it as just taking on debt, consider it the perspective of it's like buying a house. Is that you live in your house gains equity ideally. You can use that as financial leverage for other things. And so, it's a place where you raise your family. It's a place that offers you security. All of those same exact characteristics apply to doing this, is that you are putting your career on hold. You are investing in yourself for 3 years. And in 3 years, you will never, it doesn't matter if you're Dave Ramsey or Warren Buffett, you are not going to find something to invest in for 3 years that is going to transition your lifestyle and opportunities as a nurse to anything else besides being a CRNA. There is no other option out there. And so the debt is, in my opinion, 100% honesty, is 100% worth taking on. It's just something that has to be managed on the back end, just as if you were to buy any other asset, is that you're investing in yourself instead of some other object like a house or, putting money in the stock market or anything else. And so, one of the things that we do with our Facebook group, and one of the things that we have had the conversation with our students that we train, is exactly that perspective. Is they talk about the financial strain that they're taking on, or the debt, and worrying about it. And it's, once you talk to somebody who's been on the back end of this, who's paid the student loans off and everything, and can kind of shed some light on that, I think that it, like, visibly you can see some of the anxiety leave them, realizing that the paycheck will be there again. So
awesome. And I assume Hilary has the same experience since you guys are married and chose to do this a second time. But Ryan, do you have any different perspective or different advice in terms of the financial piece of it?
Yes, not really different. I'll just back up what Dan said. I agree that it's totally worth it. It's an investment in yourself.
Sure.
Perfect.
If this is something that you want to do, it's worth every penny. You're paid very well. When you're finished with school and you're working, you realize that it's not as much of a burden as you felt it was going to be when you got into it.
Correct.
And when you see these student loans come up and you're realizing just how quickly you're able to pay them off, uh, it's no brainer. It really
Sure.
is. The income difference alone makes it much easier to accept when you're finished with school. You just don't realize it. It's very scary getting into it because for a lot of reasons. Some people think, well, what if something happens? I can't finish. I've got half of school, loans and debt from this, but I was unable to complete the program. There's lots of different things. So you really just have to be well prepared. Um, and if you are, and and you have a strong work ethic, and you check all the other boxes and get into an accredited program, you'll do very well when you're finished with school. And the financial part of it will be a lot easier on the back end than you're imagining.
That's
Awesome.
perfect.
Jerry asks, does Florida allow independent practice, or do you have to be with an anesthesia group with MDs?
You want me to take that one, Ryan?
Sure.
So, Florida does allow for independent practice, and the state law, as it's currently written, is just that there has to be a physician in an operating room for us to do our job. So that can be any surgeon, a GY, like a gynecologist doing procedures, a podiatrist, eye doctor. So anybody who falls under that category of a physician who is capable of doing a procedure on a patient, we are 100% legal to do our job. And there are many instances where, for a variety of reasons, where it's actually and what I mean by that is a lot of physicians prefer to do their procedures in outpatient settings and surgery centers, and so it's sometimes easier to find CRNAs to work in those settings. And so I work full time in a hospital for a large anesthesia group that has anesthesiologists involved, and I also work independently. I'm incorporated, myself, and I work independently from probably every 3 weeks. I work independently for myself. Where there are no anesthesiologists involved. And so that's one of the things that this career field offers is just a vast amount of flexibility. You can work 1 day a week. You can work every day of the week. You can work overseas. You can work for the military as a civilian. You can work for the military as a reservist or active duty. I mean, it's almost unlimited, other than there are definitely some states that have different, rules and laws. But overall, there's a ton of opportunity out there.
Is there a good website to look at that would kind of all-encompassing talk about which states allow what type of practice? Or
I don't. If there is one, I haven't seen one. That's a great idea.
Okay, that should be your next adventure.
I was gonna say I'm gonna write this down.
Are you talking about independent practice or unsupervised or
just
full
what
autonomy?
the laws are state by state regarding a CRNA practicing?
Like how the CRNAs can practice in each state, what the options would be.
Sure. I mean, I think you could address this by mentioning the opt-out states.
For sure.
There are several states that 19, I think now, and Oklahoma was the most recent one, that have removed physician supervision entirely from the anesthesia model. So there are opportunities for CRNAs, especially in rural communities with limited access to big acute care facilities with anesthesiologists. You have CRNAs setting up their own practices, contracting directly with hospitals and getting hospital contracts and doing very well with that. So there's 19 states where the physician supervision has been removed. Florida is not one of those opt-out states yet, but the supervision specifically can be any physician, as Dan was saying. It can be the proceduralist, it could be a radiologist, a surgeon, podiatrist, dentist. Does that make sense?
Yeah, absolutely. That's great. Great clarity. So we're going to move on to your experience as a CRNA as a whole. And Christy said, a mindset is the road to success. Absolutely. I totally agree. So what were your experiences since becoming a CRNA? And then I guess let's just combine this with Brandy's question. Did you have a difficult time finding employment as a new CRNA?
So my experiences since becoming a CRNA would that be clinically? Is
Well,
that the,
I
mean,
think,
life is a lot better overall.
okay. Yeah, just what kind of experiences have you had? You mentioned that you've worked in the OR at a big hospital as well as on your own. So maybe you guys can talk about that. And there was another question in here talking about what opportunities are there. So maybe this is a good time to talk about that too.
Sure. So obviously working in large hospitals or hospital systems, even if, with community hospitals tied into them,
Yeah.
that's almost universally available, just because of the volume of patients. Outpatient surgery centers are constantly growing. There's always a push to minimize the invasiveness of surgery. And so that's where you see the outpatient surgery centers are all over the place. And so, but some of my buddies give me a hard time. Usually when I work independently, it's at a plastic surgery center, and you hear that within the CRNA world. It's like, oh, when I get tired of the hospital, I'm just going to go work at a plastic surgery center. And I took that to heart, and I love doing plastic surgery. I love doing anesthesia for plastic surgery, and so it's very artistic and creative what plastic surgeons do. It's amazing to watch, and so there was absolutely no difficulty on my end. I mean, everybody else can answer the question, but I ended up working for the Anesthesia Group that I trained with while I was in school, and which was an incredible opportunity, just because of the size of the hospital system and the variety of surgeries and techniques that we were exposed to. So
it's great.
We can.
So for me, same thing. Graduated from the local university here, and then was hired by the group that does the anesthesia at the hospital here. And for me, my experiences took me as soon as I was working and had been working for a couple of months. I let the group know that I was really interested in doing pediatrics. And since, getting into the pediatric field of anesthesia, that's primarily what I do nowadays. And that has been a life changer for me. I've truly enjoyed doing pediatrics. I never did it while working as a nurse.
Okay.
But I always enjoyed that clinical rotation when I was in anesthesia school, and it was a very brief time during school, so I knew that I wanted to come back to it when I graduated. And it's actually given me opportunities as well based on where we do a lot of our pediatric anesthesia. It's really been a huge impact on my family life and being able to be home more and still working full time. So that's worked out really well for us.
That's awesome.
I think that I'll just add to what they said. Agree with both of them. I think that the amount of surgical subspecialties that you have available to you, whether you're doing anesthesia for neurosurgery, open heart, pediatric, obstetrics, you name it. There's so many subspecialties. So, and that's going to be dependent upon where you're working, obviously. But and then Dan working independent with plastic surgeons is a whole nother ball game. But in acute care hospitals, there's tons of different surgeries, and it's fantastic that you get exposed to this. A lot of groups will allow you to sort of pick and choose what types of anesthesia populations you want to take care of. If you don't want to be a pediatric CRNA, as Hilary is, you don't have to do that. You can choose to specialize in open heart. You can do everything if you like to do everything: obstetrics, epidurals, general surgery, gallbladder, orthopedic surgery. There's so many different things that you can do, and there's so many different ways that you can do these anesthetics. So the science of the anesthesia is just amazing, and it's a lifelong learning experience. There's just so many. The evolution of healthcare, and as Dan was saying, is minimally invasive procedures that we're seeing now. It's just constantly evolving. So we're evolving with it, and it's exciting because it's not a static profession. It's something you're constantly learning new stuff, and you have a lot of control over what you do.
Absolutely. It's one of my favorite things about nursing, really. The versatility and the constant learning.
Exactly.
Absolutely.
Hands down, our career is amazing. So Courtney wants to know, did you feel that the CRNA program you attended adequately prepared you for your first CRNA job? And maybe you can speak personally, but then also, do you feel like CRNA schools as a whole also prepare you well?
So speaking from my own personal experience, absolutely. I was incredibly fortunate to go to school where the group that was training us was extremely versatile. You had anesthesia providers, both anesthesiologists and nurse anesthetists from various backgrounds who had learned along the way how to do anesthetics in different ways. And so that was wonderful because coming out of school, I had a variety of ways to do certain cases, and I was exposed to almost everything except for level 1 trauma, but we saw other things that were, that equated to that. And in terms of CRNA programs, you do work within our group. We have almost 175 CRNAs, and so we come from all different backgrounds. And I have found that the CRNAs that have been hired within our group all have come from strong programs. They all come with different ways of doing things, which is great because then you have the ability to add into what you already know. So, that would kind of answer the question from my perspective, both personally and both professionally, what I've seen within the group that I've been with.
Yeah, I agree. You guys have anything vital to add to it? We're trying to go fast for those of you who are watching, not fast, but to where we're not getting an answer from all three of them, just so we can maximize our time and cover everyone's questions. So if there's not vital information from either of you to add, then
we can move on. Let's get to all the questions.
Sure.
Awesome. Let's do it. Okay, so Courtney also wanted to know, like your orientation as a new grad nurse, you have an orientation period with a mentor. Is that a similar experience when you graduated as a CRNA?
Yes,
Okay.
actually it is. And it's probably facility and group specific. I don't think it's going to be the same across the board. And it's going to be dependent upon how well prepared you are when you come into the profession out of school. I think our group offered us 2 to 3 weeks of having a mentor and orientation. You learn how to use the computer system and chart your anesthetics and just the logistics. You come out of school ready to pretty much do any type of anesthetic for any type of surgery, but there's an adjustment to getting used to a specific group's style or way of doing things and the pace of the operating room at that specific hospital. And every surgeon is different. So you have a mentor for, I believe, a couple of weeks. And whenever you're ready to sort of break off from that person, they just let you do it at that time. I think I had about a week, a little over a week. Yeah, but all the resources are available. They want you to be successful, or else they wouldn't have gone to the trouble of hiring you. And
sure,
yeah.
And you're never alone, right? Like, what does that look like? Well, the next question is, what's a typical day like as a CRNA? So I guess this question can kind of lead into that, in that if you're in the OR, you have some funkiness and you have a question, you're not alone, right? There's someone you can ask.
Sure, for sure.
Okay.
So, I'll incorporate everything that you just asked into one. A typical day as a CRNA would be, you obviously wake up, get ready for work, head into the hospital. I would say most times before you get there, you have a pretty good idea, certainly of what your shift is going to be. Specifically, for 7 years, I worked multiple days doing open heart anesthesia. And so you go into work knowing, they're long cases, critically ill patients usually. And so there's time where you are able to set up for your anesthetic. You don't specifically know what cases you're doing, but when you're in school, you do so many of the same type of cases over and over and over and over again in every different specialty, that when you come out of school, you're ready. You're like, I want to see what I'm made of here. I know how to get everything ready. I know the sequence of events. So we would head into work. We would, prepare our medications, our airway equipment, whether it was art lines, central lines, whatever it is that we're going to be doing for that day. Obviously, open heart is the preparation is very labor intensive, and then we have a surgery start time. You head out to pre-op. You meet your patient. If there's any pre-medications to give, you're obviously looking over an pre-anesthetic assessment that has been done, and then you're meeting the patient, trying to build some rapport with them. You're a stranger to these people largely, and so that allows you to be objective, but also you're trying to build some trust. Let them know that you're going to look after them, you're going to be at the head of the bed taking care of them from the second they go into that operating room until we drop them off in an ICU or a recovery room. And so that's another misconception that we like to dispel, is that we never leave. I mean, if everybody else walks out of that operating room, we're not walking out. And so if, to answer your question about if something gets a little funky or, things get critical, then, in most places there's other anesthesia providers around that are going to come and help you. The other thing is that a lot of people that work in the operating room have been doing their job as long or longer than we've been doing our job. And so, they've seen things and picked up things along the way, but if things get a little funky, it's usually our job to kind of control the situation at that point, keep people safe and give medications, direct others, all the way up into, doing CPR, ACLS, whatever it is. And obviously doing the pre-anesthetic assessment kind of gives us a risk profile of what the patient is potentially looking at. And so we try to prevent problems before they happen a lot of times. And so we try not to get caught off guard. And we basically go through the day like that. And hopefully it's a boring day. I mean, a good day in anesthesia is a boring day. Everybody wakes up, everyone goes wherever they're supposed to go, whether that's go home. And then we come home and open the door and feel 100% fulfilled that we've helped society and taken care of our patients. And then beyond that, then it's, family time. Our kids are big time into baseball, whatever, personal endeavors, if you will. And then people do that, like I said, one day a week or as many days out of the week they want to do that. So.
Okay. And do you do on-call as well?
It just depends on where you work. For 7 years, I was never on call. When I worked for myself, I was never on call. The hospital I work at now is 3 miles from where we live, which is great, but there is a call requirement. And so, we're on call and being on call, it totally depends on the environment of what the call actually requires. If you're at a big hospital, very busy trauma centers, you're going to be working a lot. If you're at a smaller community hospital, they have to have somebody there in case something happens, but it doesn't happen very often. So.
Awesome. That's great. Sounds like there's lots of flexibility there. That's not what my initial preconception, that's not what I was thinking. So that's really neat.
Sure.
I'm always learning something new. It's my favorite thing. Okay. So Courtney asks, is the profession and job rather mobile? I'm a military spouse and have been holding back on applying due to our moving schedule and fear of being unable to find a job at each new duty station. They move every 2 to 3 years.
So I'll answer that question just because I vividly remember my parents living like this. I have 2 younger brothers. My dad was active duty for 23 years in the Air Force.
Yeah.
18 of those, he was full-time CRNA and was on call 24 hours a day. He had his bags packed by the front door. It was a rule in the house, don't touch those bags. You know what I mean? Because he could be called to go somewhere at any point in time. And my mom was active duty for 4 years. She understood that. And so she is also a nurse. And so if we're looking at it from the perspective of being a CRNA, is the profession and job rather mobile? I would say yes. It is. There is a massive amount of need. There is a shortage of anesthesia providers. That includes CRNAs. So it's overall, I would say it's pretty easy to find a job anywhere you go. Is it going to be right down the street or exactly the hospital you want to work in? That's not necessarily guaranteed. If Courtney's husband is she's a military spouse, and so she would be able to find a job pretty easily anywhere she goes. The other thing that I don't know the specifics of it, but I do know that there are multiple opportunities due to the shortage of CRNAs that are in the military that they will hire civilians as contractors to provide anesthesia in their hospitals. And so that was something that my own father looked at doing overseas after he retired from the military. And so I would say the profession and job specifically, it does allow for a lot of mobility and also allows for a lot of flexibility in finding jobs if she was doing this and her husband was active duty. I don't see that being a detriment at all.
Great. And are there travel assignments? Like I did travel nursing for several years. Are there travel CRNA assignments as well?
Absolutely. It's called, in the CRNA world, it's called locum tenens.
Yeah.
You'll hear people talk about locums. And it is set up very similarly to the way that the travel nursing assignments are set up. There's the housing aspect to consider, vehicle aspect to consider, travel costs, it's just like, it's almost like its own little specialty. And there's people that love doing that. And, it's great because you can do them. Sometimes you just fill in for a week. Sometimes you're there for a year. A lot of times it's, hey, come do a 90-day stint with us. If we like you, we'll extend you. It's very similar.
Awesome. Courtney has another question. Besides the obvious OR opportunities, what other areas utilize CRNA? Do you have anything to add to that? You pretty much covered it. She said, I know from working in the ICU and PACU that anesthesiologists can become certified in specialty areas, cardiac bypass and pediatrics. Is it the same for CRNAs? You covered all of this, I feel like. You have anything to add?
Ryan, you want to answer that one?
Well, I think, the COVID thing has certainly changed a little bit of that. We were deployed in different areas. Some of us, I wasn't personally deployed. Our OR schedule was light for the better part of 2.5 months. We turned down anything that wasn't an emergent procedure. We're very careful about who we were bringing into the hospital and making sure we had the bed capacity to manage this surge that we were expecting. Thankfully, we didn't have a big problem with that. So outside of that, we typically are using the operating room specifically. I'd say that's group specific. Where we work, they don't really deploy us to the ICU to cover a shift that somebody didn't show up for, or we don't really hang out in PACU, and those departments sort of take care of themselves. The COVID thing did change a little bit, and we were needed in various settings to provide some critical care support, airway management, invasive line placement, and just critical care management of patients in the ICU. I wasn't one of them. Had enough work here to stay home, but I do know some people that went out of state and did some really good work. So other than that, just the regular work schedule here, primarily in the operating room or procedure room, wherever it is you're working.
Yeah, I did hear about some groups, maybe just hospital groups, who organized this in this fashion, where they were using a COVID airway team of anesthesiologists and CRNAs to fill that role. So nobody else was being exposed. The ICU attending wasn't being, residents weren't. It was only that group of people who were intubating these COVID patients. That's really interesting. Glad you brought it up. So Brandy wanted to know, what's the most challenging part of your job?
I'm gonna have to say getting up early every day. Not gonna lie, that sometimes gets old. In my previous career, I was getting up really early as well, and so that getting up early has transitioned into this career as well. And there are just some days where, even though I love the work I do, that alarm going off at 5:15 can be a little rough. So.
Hilary, we're losing you out of the frame, just so you know. We're about to get into, I feel like it's Hilary's jam here, the work-life future balance of all of it. So what led you to the Nurse Anesthesia 101 group or adventure for the three of you?
Brian, I think that's all you.
Well, yes, I think this COVID thing gave us a little bit of downtime, and I do a lot of precepting in the operating room. I have a lot of students come and shadow me, ICU nurses, nursing students, nurse anesthesia students that come into my OR to teach them various techniques and ways of using anesthetics. From the nursing student side of it, and the nurses, the ICU nurses, there was just the information they were getting was all over the place with regards to getting into anesthesia school, getting into the profession. And it was literally every time I had somebody in the operating room, they'd ask 2 or 3 of the same questions, and then they would tell me that they heard something entirely different. And I was just thinking of just bewildered at the fact, and a lot of people were saying, I considered not even coming and shadowing you because I didn't see a point, because I didn't want to be in the ICU for 6 years before I got into anesthesia school. And I'm like, where did the 6-year number come from? Because that is not the case at all. So Clarity, I think is, how do you get to anesthesia school? There's so many steps to do it, and there's really not a wrong way to do it. Everybody's timing is different. There is a quick way to do it. There's an easier way to get there logistically. If you're willing to do the work, you can get there without having to uh, go through a lot of the growing pains that a lot of people do just because of the lack of information or the misinformation that's out there.
Yeah.
So, Nurse Anesthesia 101, we're big supporters of our profession. We're very active politically in our profession. We love what we do. We promote what we do. We've always done that. And I saw it as an opportunity to shed some light on the process of getting here. I've just seen so much in my sample size, just where I work, and I know it's everywhere. You just see it on social media, just so much misinformation. It was frustrating. So I said, we need to be myth busters on this, more or less. So,
Nice.
and support the profession as well. So,
Absolutely.
That's great. I think Kelsey and Courtney both asked, how do you create a work-life balance? Are you giving up family for work as a CRNA? And Courtney specifically said, I have 3 small children and a husband in the military, and she's not wanting to replace her family with her career as a CRNA. What's your take on that?
So I'll take that one for the team. So for me, that was kind of one of the challenges that I looked at, between even being a nurse and even being a CRNA. Nowadays, I work shorter shifts. I do work 5 days a week, but my shifts usually have me out between 1 and 3 every day. And so the advantage for me was I could be home in the afternoon with our kids when they got home from school. I was able to manage them with homework, get them to their sport, things that they had to attend. And so I felt like I was able to do the work that I was doing and not giving up what I wanted to do with my family. The other thing that I looked at is because of this, the hospital that Ryan and I work with, we don't have on call. So I wasn't being taken away from that perspective as well. There is some weekend requirement, but it's very minimal. And we're fortunate enough that because our group is so big, we have the advantage of sometimes giving those shifts away and not being absent from the weekends at all. And so that was something that was great because as a nurse, I had to work every other weekend. And so that was always really tough as a mom to be gone every other weekend, to plan things as a family, miss sporting events. Mm-hmm. So I think as a CRNA and even as a student in school, you can still find that balance. The other thing that I recommend, which is what I didn't have necessarily, thankfully I had my husband, was I was the only one in my family that was down here. So when it came to family support, I really had to lean a lot on my husband. I didn't have my other family members down here that I could maybe take our kids to for a couple hours so I could study. And so that's something to consider as well, is when you're looking at programs, where are they located? Do you have family nearby that would be willing to help you out in a pinch, or even have a schedule with you where okay, every Saturday for a few hours, the kids are going to go with grandma and grandpa so that I can, do some focused studying and then be open for the rest of the day to be with my family.
Yeah, that's great input. I was actually going to ask, did all 3 of you have children when you went through CRNA school?
I did.
We sure did.
Yes.
That's
Yes,
awesome.
we had 6 children in grade school when I was in anesthesia school.
Wow. Did you figure out what's causing all those?
We finally did.
Good. All right. So to close out our time today, Jenna and Kelsey asked, what was the most important piece of advice you have to give someone interested in this career path?
I'll start.
Okay.
Plan ahead. Determine what your resources are. Look at the programs that are wherever you're going to be, and have resources in place. Work ethic. Work hard now, because what you do now is going to determine whether or not you're waitlisted or you get right into school. Get in as soon as possible. A lot of people, I see a lot of ICU nurses that have wanted to be CRNAs for years.
Yeah.
And they just hadn't done it yet. They're just, they're just waiting, but they want to do it and they're going to do it. And a lot of them have ended up becoming CRNAs, but they really didn't have a reason for just waiting other than weren't quite ready yet. And now they're CRNAs and they look back and they say, wow, the income difference between now and when I was working in the ICU is significant. Why did I not take that 5 years ago? What have I been doing? I've known that I've wanted to do this. Why have I mean, if you add up 5 years of the difference in income, that's a lot of money. So if you know you want to do it, just go for it. Make sure you can do it. Make sure you want to do it. Job shadow often, learn the profession. And once you've established all of that, just go all in. Find a mentor, somebody. If you know somebody who's a CRNA that can help you with the steps and sort of help you sort out the logistics of getting through school and checking all those important boxes, utilize that. But start academically now, even for beginning nursing students. The very first class you take in the very first semester of nursing school, prerequisite nursing students, shoot for A's for every class. Don't just try to get by, and just go for it.
Awesome. Hilary and Dan, you guys have anything you want to add to that?
I think for me, being a mom, I think that there are a lot of families out there, moms or dads, who are worried when their kids are young that when they're going through this program that they're going to miss out on a lot. And I'll be totally honest, our kids were 2 when I started the program, and they do not remember any of that. They don't remember mommy being gone to study or mom's in the office again reading. And I would be more concerned now that they're 9 that I would be missing, and they would be missing me more now. So if you have any hesitations about that, just keep in mind that when they are young, it's probably harder for you than it is for them. So that's just something that I like to say as well.
Yeah, that's absolutely a great advice. And in our last question, I don't have any more questions coming in. I want to know what you guys are most excited about in terms of Nurse Anesthesia 101. What do you guys have up your sleeves?
Oh, wow. That's a loaded question there.
Yeah, it is a
How much
loaded
time
question.
do we have? Dan, you want to start with that?
Yeah,
or?
Sure. What do we have up our sleeves? So we are going to be, our goal is to become the premier resource in the nursing student and nursing world to help people achieve their dream of becoming a nurse anesthetist. And not to go backwards, but to tie in, like, the most important piece of advice, which fits into this answer too, is that being a nurse is a difficult thing. You're taking care of a human being. It's probably the most difficult job in the entire world. And so if you can successfully do that, and you can focus on the didactic portion, you have the ability to become a CRNA. It's already there. What we're trying to do is sift out the people that have the desire to do it and make sure that they successfully accomplish that in a strategic way, to be strategic about how they do it, so that you're not the person that is 5 years down the road saying, I don't understand why I didn't do this before. And so Nurse Anesthesia 101 is basically is going to be a collection of information and resources to make that simpler for people.
That's amazing.
Yep.
I can't wait to be able to direct people your way. I know you guys have a lot of other things in the works for Nurse Anesthesia 101. And so anybody that has questions, input, seeking advice or direction, follow their group and shoot them a message. I'll link everything here. And if you guys think of things that might be helpful to those who are viewing in terms of links, let me know and I'll put them in our show notes so people.
You too,
Thank
Chelsea.
you, Chelsea.
Thank you.
All right. See you later.